Well, we might get started just to honour those who've arrived on time. So welcome to everyone. My name is David Pearson. I am the CEO of the Australian Alliance to End Homelessness and very excited to be here to launch this new report on ending homelessness. So just as I mentioned a moment ago, we're going to have some Q&A later on. So if you can make sure you name yourself and tell us where you're from, that'll help with the Q&A session later on. But can I start by acknowledging today that we all meet on the lands of Aboriginal or Torres Strait Islander people here in Australia and pay our respects to any elders past, present or emerging that may be on the call, and that we do so in a spirit of reconciliation and recognition of the deep costs that the sharing of the land on which we meet today came for First Nations people in Australia, and leaves a lasting legacy that we know is absolutely reflected in the issue we're talking about today, which is homelessness. So can I acknowledge where we are today, the land and the people that we pay our respects to. And you may also wish, given the diversity of people we're from today, to pop in the chat feature about the land that you're on today. I'm on Kaurna land here in Adelaide, so feel free to pop in the chat where you're from and pay our acknowledgements in that important way to share. So just a quick run through what we're going to cover today. So I'm going to give a little bit of background. Thank you for those who are starting to put where they're on. Alice Worrell in Adelaide got in first, nice work. So we're just going to run a little bit of background and then we're going to hear from Lee, who's going to tell us a little bit about his story, who has a lived experience of homelessness. And then we're going to hear from Paul Flatow, who's the lead author on the report that we're releasing today. And then a bit of a discussion. So have a think about the questions that you might have when we're going through that later on, and feel free to pop them in the chat after everyone's finished introducing themselves and where they're from. And we will try and make this as interactive as we can, given that we have, I think at last count, about 780 registrations for today's session. So really excited. There's so much interest in this really important topic. Just to start with about us, so the Centre for Social Impact is a collaboration of a number of universities across South Australia, and they're really committed to translating research for impact and have been a key partner in the work of ending homelessness since the Australian Alliance was created and over many years. And Neami National is the other partner in today, key partner in today's event and for the commissioning of this report that we've done. And they're a mental health and homelessness service provider, amongst other things, around the country. And we'll have Shane speak from there later on. With the Australian Alliance to End Homelessness, we are a community of practice that's committed to leading a movement to end homelessness in Australia. And the ending homelessness is in the title of this forum, it's in the title of the report, and it's absolutely central to what we do. Ending homelessness is possible, and what we're seeking to do as the Australian Alliance to End Homelessness is to support communities to demonstrate that that's possible here in Australia. We do a range of work, and you can see some of that information on screen. But it's really a collection, it's a collection of organisations, networks, collaborations, and individuals right across Australia who share this joint commitment to end homelessness. And what you can see on screen is the state of our movement at the moment that's constantly growing and adding more and more communities and organisations and collaborations, as I mentioned. And what I mentioned is that we are built very much on a movement internationally that is demonstrating that ending homelessness is possible. In fact, there's now more than 14 communities in the United States that have ended homelessness and demonstrated that with data. And we've seen that grow, and we now have the first 2 communities in Canada that have also ended homelessness for either chronic homelessness or veterans. And you can see some of the information on the screen from the Built for Zero collaboration over there. So in Australia, we're united by this idea that we want to end homelessness, and we're very much motivated and inspired by what's been learned from those communities in the United States. But we know that Australia has a different context. And so what we've sought to do is build a methodology that we share amongst all the communities. And the research that's been done through the report that Paul and his team have led is really help inform this, because data has to be central and evidence has to be central to our efforts to end homelessness. That's a commonality across all communities around the world. And so what slide we have on screen at the moment is our attempt at mapping out what's involved in that methodology and using it as a bit of a checklist to help us about the things we need to do if we want to demonstrate that ending homelessness is possible in Australia. And there's more information about the methodology and the work that we do on the Australian Alliance to End Homelessness website, and of course, in the report we're launching today. And so the last point I just wanted to share was that we're seeking to drive this change through improvement cycles, and improvement can only happen if we work collaboratively and use the data and evidence that we need to drive that change. And so what's really important about the report we've been launching today is that it helps guide those cycles of improvement. It helps us tell us what is it that we need to focus on, what are the key insights that we're learning from this work. So no further information from me other than to say that this community that we are building in Australia, this report that we are launching, are all aimed at sharing the knowledge that takes us to the place where we will end homelessness in Australia and make it rare, brief and non-reoccurring. That's our mission. That's what we're focused on. And I'm really excited we can have so many people here to share with that today. But to start with, I'm going to hand over to Lee, who's going to share a little bit of his story, and have some conversation with Priscilla Endels from Neami National to tell us a little bit about, your experiences.
So Thanks very much. Thanks very much, David.
Thanks, David.
I want to acknowledge that Lee and I are zooming in today. I'm on Wurundjeri land and Lee's on Gadigal land, and we pay our respects to the elders and custodians of these lands and to any Indigenous people who are with us today. Today you're going to hear about this important research, and it's research that Neami has been very pleased to support, because we know that real change to end homelessness requires collaboration between service providers, researchers, data custodians, policymakers, funders, and importantly, people with a lived experience of homelessness. You're going to hear some big numbers in this report, but it's really important to remember that every one of those numbers is a person, and every person has a unique set of circumstances that has led them to homelessness or housing insecurity. And we need to pay careful attention to these stories and these experiences if we're going to make a difference, if we're going to end homelessness. So thank you, Lee, for being willing to share something of your story as a way of keeping all those numbers grounded in the reality of people's lives. I met Lee because he's been supported by Neami's STEP program for the last 2 years. That's the Supported Transition and Engagement Program for people exiting rough sleeping in New South Wales. So Lee, to start with, can you tell us a bit about your life now, how things are travelling at the moment?
My life now?
Yeah.
Things are travelling fantastically. I've finished a course in Community Services Certificate 4, and then went in and did a bit of support work with St Vincent de Paul and with Cana Communities, which was volunteer work for 18 months. And then now I've started a business with a partner with the NDIS in disability, doing support coordination for people in the disability sector.
Yeah, fantastic.
Yeah.
And you're talking to us today from your home?
I'm talking to you today from the place I live in through Neami that I've lived for the last 2 years. Yeah, and it's created great stability, and I wouldn't have got to anywhere without the importance of being safe and organised, and
but things haven't always been quite this stable, have they, Lee? I wonder if you can take us back to, in our discussions, you were telling me about it's been, before you got this house, it was 20 years between tenancies.
I haven't held a tenancy since the 90s. You want to hear a bit about where I stayed and things like that?
Yeah,
well,
absolutely.
I did a lot of living on couches and bouncing between. I had a business, and I unfortunately fell into a rut with drugs and whatnot, and it ended up rendering me homeless. And from there, I lost everything. I was living on couches until I started moving into factories. I was living in spray booths, old abandoned panel shop spray booths. There's no cleaning facilities, cold water showers. I lived in factories, abandoned factories in industrial areas, big industrial areas, and we'd have to break in and stay in them. I don't know, is that what
Yeah. And can you tell us a bit about what was it like day to day during that time for you?
Basically, day to day just becomes a struggle to make it to the next day. Really, I didn't seek support so much then. Unfortunately, I fell into some bad traits, and I ended up spending some time incarcerated, and sort of got to come out. And luckily at the end of that, when I came out, I did try and seek support. So so for a good 15 years, I never, there was no one on the ground that ever approached me and sought me out to make me understand that there were supports out there. I wasn't experienced in finding support before, and until I did look for support when I came into the community and decided I really do need help, and looked at it and found that there were places like Neami that were willing to take it. Yeah, so that for all the years up until I had this property here, I didn't seek support, but there was no one out there really. I think in regards to, I saw a Housing First approach there by David that just put out, and I think that is ultimately the ideal way. So, but with that Housing First approach, I think the New South Wales government and the NGOs that they work with, I think they need to be more transparent with what they're doing with their housing, and being upfront with the people that they're trying to house, and giving, I think if you're on a waiting list, if you didn't have the help of Neami or anything like that, you're in a bubble. You don't really know where you know. So I think they need to be a little bit more transparent. I know it would be hard, but with the client, with the person that's on the priority for their housing and looking for something, just so that they have some hope, like giving them an idea that there's a 5-year wait and no correspondence with them, or being able to give them any idea of what's happening is near impossible. And it's hard for that person to understand what's going to happen to them, like until they get that house. And there is so many properties out there that are just left, you know, I can go into more.
Yeah, sure. So it sounds like, Lee, that it's actually, when you're on the street, it's actually hard to find your way to the support service that might be helpful.
Yeah.
And it's
okay.
And
yeah.
and if you do get a message, then you know it might be, you know, it's going to be a 5-year wait until you are eligible for housing. Yeah.
So until I tried to seek help and to think, I had no idea about how community and non-government organisations worked. I didn't know, you know. It was like, I can walk down to Vinnie's and get a voucher to go to get a thing. I can go over there. They're giving a free feed at the Salvos. I know I can go there, but that to me was what the organisations did. I didn't know the depth that they had. I just so I think outreach is honestly the most important aspect of the whole thing, being able to find and identify the person that needs the help first. So I think more feet on the ground too is a good thing. So honestly, we've got referral processes and things like that, but people need to get up and to get to that referral, you know. But a lot of your homeless community can't make that move. So it's a never-ending thing. It's so massive. Like, even with the referrals that you do have, you're still struggling to find housing for everyone. And then if we go looking for more people that are homeless, then we've got an even wider problem. So that's but outreach is a good outreach. I think it needs to be funded a lot better because I work with a few services, and the government's quite willing to give some funding towards their enclosed situation, and their caseworkers and everything are there. But when you start talking about an outreach program, they seem to shut down their funding, and to give them from what I've noticed with the people, that the outreach isn't funded as strongly as it should be. And I think that's a very important point. Like living down here, Wentworth Park, we've got 14 arches with 30 people living in them. 15 of them wouldn't even know how to start to look for help. You know what I mean? Just if they could have someone that was regularly down there and gathering information and data, and maybe getting a few medical things done with them, or just any sort of report they can, so they can submit that to housing and obviously get noticed for priority housing, so they can process everything quicker, would be a lot better, you know? They're
really important points, Lee. What about for you when you got notified that you did have a property and then you started to get some support? How did that change things for you?
I was so unorganised. I didn't know. I've come from. I've grown up. I did an apprenticeship. I've got 2 trades. I've owned a truck and had a business. I was organised to the point where I could manage all that. So I've never been overly organised. Like nothing was ever filed at home or anything like that. But so by the time I'd gone through the 15, 20 years of homelessness, and I got to the point where I needed to seek help, I was that unorganised. I didn't know. Honestly, I'd lost learning how to cook. I'd lost, just how to manage your clothes. Just a whole lot had just gone. Like just managing your life in general. Finding out I had the home, knowing that I had a support and a caseworker that was assigned to me that I could call. Whilst I was in my own space, my own area, he initially, because I hadn't lived here before, we went on a few outings here. I got to know the layout of the place. He linked me up with a gym, and I suddenly started to find happiness in the gym and things like that. So it was enormous. It was like I couldn't have done it honestly on my own anyway. I could have quite easily lived here, but without the support, I would have slept on the mattress on the floor. I wouldn't have bothered about putting a base there. I wouldn't have gone and got just to come in here, have your basic needs met. Like I've got a washing machine, a fridge, it's phenomenal when you don't.
Yeah. And you were telling me how you managed to reconnect with family that you'd lost contact with as well.
Okay, so I got a house, and now I've got, so I haven't met a niece and a nephew since they were born. They were 13 and 12 when I met them. I've got a mad relationship with them now. They love me. I love them. I'm back with my sister. Unfortunately, my parents passed away in the past few years, but I managed to get back and connect with them again. They've all come and stayed with me here. That's
fantastic, yeah. Lee. So what would, I mean, I don't know if you have a final message, but what would you want to say to people about what matters in ending homelessness?
So who am I talking to? The government? Am I talking to who am I saying?
Yeah, talking to the government.
Well, if I'm talking to them, I'm saying pull your head out of your ass and just start putting some money where it's needed. Like I don't know. I could go into my brain goes mental on there's so much I can't. I'm not educated enough to stack it all and say it properly, and I can't. If I could sit there and write for 3 days, I could get it all to you. But there's simple steps I think that's necessary in the organisations I work for. Like I work for one that's got no funding at all. It's run by a church, and I see them out on the street able to do things that the government won't fund and help people with because they limit it. I think the options and the transparency that everyone needs to show each other needs to be better. I think we need to be able to talk. I think we need to be able to go to DCJ and put a case to them and have it listened to instead of a uniform response to everything. I think the closed offness of them when they're offering housing and it's just a battle. Look, I get confused. I don't know. It's just I honestly more people, the government get more people on the ground supporting people that can't find the avenues that they need. If I had the support that Neami has given me 20 years ago, my life would be completely different. There wouldn't be I would have exited 15 years of pain, struggle, home, just sickness and everything that would have been lost if I had have known that I could have got that help. And all that would have been an outreach service that could have found me somewhere, somehow. You know what I mean? If we had people out there looking for the most vulnerable and the most marginalised, and then working with them. I know it's not easy. I know it's near impossibility sometimes, but to identify and at least have a record and knowing where these people are and what to do, and then some sort of, I know they're out there, but I just think it needs more.
Yeah. Well, thanks so much, Lee. I think you've, you know, it is really important to hear stories from people who've had these experiences directly. They really tell us important things and show that, you know, pretty bleak situations with the when affordable housing and the right kind of support comes together at the right time, it can really turn things around, transforms people's lives.
Absolutely.
Yeah.
Absolutely.
So thanks so much for sharing today, and we'll hand back to you, David.
Thanks so much for having me. See ya.
Thanks, Priscilla, and thank you so much, Lee. That was such a wonderful way to open this conversation, and thank you so much for sharing your story. We know there's been lots of comments in the chat, but I'm sure you'll have a look at it in a minute. But people are so appreciative of you reliving something that was a tough time in your life, and has really framed up the conversation we want to have today perfectly, because this is what it's all about. And I saw Sarah in the chat comment that you are actually one of the most educated people about this topic, and we really need to make sure we listen to you. So your advocacy and the distilling down of what needs to be done into such simple, actually evocative phrases was really helpful and bang on. So thank you, Lee. That was wonderful. And thanks again, Priscilla, for facilitating. So we'll move on to Paul Flatow, who anyone who's got a sort of interest in ending homelessness would probably know of Paul. He's one of the leading researchers and experts on the issue of ending homelessness in Australia, has dedicated a large amount of his time. The entire time I've known Paul, he's been passionate about using data and understanding the data we're collecting to inform efforts to end homelessness. So Paul is the acting CEO of the Centre for Social Impact, as well as being the director of the Centre for Social Impact in Western Australia. And Paul, really excited to hear how you're going to summarise this tome and massive amount of information down into a short little presentation for us. So Paul, thanks for being here, and over to you.
Great, thank you. And thanks, David, for that. And thanks, Lee, as well. An amazing story, Lee. And I noticed that Al Connolly from WA also put that link to the Guardian article, and Al has experience similar to yours, Lee. So you can join up, maybe the two of you, but Al, thanks for sharing that Guardian link. Yeah, I'd just like to begin first by acknowledging that I'm on Whadjuk Noongar land, and so is Leanne Lester, who is in the room with us here as well, one of the authors. And I noticed quite a few in the early period were from Whadjuk Noongar land as well, so that's great. Jess, one of the authors, is on the panel later. We have a number of authors, as you can tell. So we have Leanne, as I mentioned, Jess, Amy and Zoe, Shannon, Chris, and Renee. So it's quite a big team. And the team really has done a huge amount of work. As David mentioned, it's a tome. It's around about 280 pages counting. And if you want to check it out, you can get it from the CSI website or from the Australian Alliance to End Homelessness website or Neami. I'm sure it's up there right now, but we'll put a link in the chat if not. So this report, which is very large, essentially does three things. It looks at the advanced to zero data. Now that data set is huge, and it's been developed by community agencies across Australia. And Jess will talk a little bit more about that background later, but that's 20,000 people who are telling their stories like Lee. And that information has been developed from organizations connected to the End Homelessness project, the Zero projects around Australia, all concerned with ending homelessness, and it's come from them. So I'm going to spend a bit of time just talking about that. But the report does more than that. It actually looks at the state of homelessness in Australia right now. And as you can see, if you look at the report, there's increasing homelessness. We do link it to the underlying drivers, and I'll talk about that later. And the third thing that we do is talk about the agenda going forward. So what is the policy? What are we going to do to end homelessness in Australia? So let me just share with you the screen, and hopefully this will work. And I think it is working. So you should have it up there right now. Excellent. So First, let's look at the Advance to Zero insights into homelessness in Australia. And there's a picture. We are talking about going back to 2010. And this is a picture that Karen would know very well. This data has been collected since 2010, and it's a decade of data connected to services who are interested not in data per se, but in understanding the circumstances and needs of people, and helping them, supporting them transition into housing as quickly and rapidly as possible, and with full support where needed. So I'd like to acknowledge all of those agencies and all of those people who answered questions, did the survey, and worked tirelessly to get into housing. And so it's a really big data set. So as you can see here, it covers most of Australia. It doesn't cover every part of Australia, but 20,953 people are in this database. And over 7,000 said they slept most frequently on the streets and parks and cars and the like. So this is a huge amount of rich information that has been delivered by people experiencing homelessness. And we want their stories to be acknowledged and for this data to mean something in terms of understanding their experience and transitioning to an end homelessness strategy for Australia. As you can see here, starts at 2010, goes all the way through to the end of 2020. So it's a very large database. Just a few stats from it. Average length of time, 3.8 years. That's the mean, of course. And if you go into particular groups there, for example, the rough sleeping group, you'll actually see a higher number. And in our end homelessness targets, we actually want to see this number dramatically reduce. So why anyone should be spending 3.5 years, but actually in the data we see 20 years, 30, 50 in fact. We see people who've been on the streets for a very, very long period of time. And if we're going to see that end homelessness agenda really take off, we want that number reducing every single year. Now, one of the things that is evident is this long history. So we know that 70% of those sleeping rough had been in out-of-home care at some point as a child. We really need to look at stopping that entry into long-term homelessness, and you have to go back to those early years for many, not all, but for many. You know, for example, youth detention. So this linkage back to the past for many people is significant, and we need to work with kids and families. The role of family domestic violence is huge, and we need to work at that end as well as the endpoint end. As many of you know, there is a significant overrepresentation of Aboriginal and Torres Strait Islander people in terms of homelessness. It's way above the representation, if you like, in the Australian community more generally. So it's a very important part of what we do to end Aboriginal homelessness and focus on Aboriginal services, Aboriginal-led, owned and controlled services, working in terms of those who are experiencing homelessness. It's a very significant issue that we need to address. Now, one of the things that comes out from all of the data is the very significant health issues that are experienced by a significant number. So here you've got indications of some of those chronic health conditions. Over on the right-hand side, you can see compared to the general population. So something like hepatitis C 20 times. We also see significant alcohol and drug use issues. But in terms of mental health conditions, way above the general average. PTSD, schizophrenia, incredible rates relative to the general population. But there's all sorts of other health issues as well. Dental problems, foot problems. Many of these areas don't get the kind of support financially that others do. And there is sometimes an actual financial problem in terms of accessing healthcare. So you have very serious issues, serious brain injury or head trauma. And we know from the stats that in terms of those who are veterans, the brain injury factor and head trauma factor is above those in the group more generally. We also, in the data, really pick out very high rates of serious issues amongst women sleeping rough. And whilst there's been a lot of focus on older women in terms of homelessness, which is good because that group has been increasing, there hasn't been enough focus on women sleeping rough and the issues that they face in the community. What those health issues convert to is significant costs in the health system. So amongst those who are accessing support, so one thing to point out, we find often that people will use stats on things like healthcare costs or health problems as though it applies to everyone. It doesn't. There are many people who are experiencing homelessness who actually have very low use of healthcare facilities. But on average, and amongst those who are accessing healthcare facilities because they have health issues, the cost is so far above the general population. And what you're looking at there is just an annual cost in 3 areas of healthcare, not the full suite of healthcare costs, but it's just an average, and some will be well above that. Now, when you think of $30,000 cost, $44,000 cost, total cost, you can add it up yourself, of what, 42,000? So $42,000, how does that compare to the support dollars per person? Well, it's way above. And so the argument is that by providing housing and enabling people to stabilize with support, we will in fact reduce those costs, and all of our research has shown that over time. Just want to give a bit more of a human story here that you got from Lee. When we asked, when services were asking the question, what do you need to be safe and well? The vast majority, almost 100%, we're talking about housing and the importance of permanent housing. I want to get permanent housing. What does permanent housing mean? It means safety. It means I can keep a pet better. It means routine. It means a chance for a job. It means structure. It means I can get my family together again. It means I can get custody of my boys. It means a degree of independence. So that answer, those answers, and we had 9,000 answers like this, 9,000 answers like this in the data, giving the stories, far and above anything else that comes out. But I would emphasize that there are other things that come out. You know, what do you need to be safe and well? I want to have, you know, social relationships. I want to be connected to people. I want to engage with people. I want jobs and so on. But housing, stable housing comes out top. This is just a picture from David. I'm sure you're there in the picture somewhere, David, but Advanced to Zero project. And so out of all of these collections that this group here that you can see and others right around Australia have been engaged in for 10 years, we get that big picture of homelessness. That data is also stretches into the journey from homelessness to housing. And this is where the work around the by name list has come in. And this is active use of data to support people to get into housing. And also shows the extent of the problems. Like, you know, we want to have an immediate transition into permanent housing for all. But the data that is being kept, and all of the sites have diagrams like this around Australia, shows that there are too many people who don't get into permanent housing, too many people who we don't know enough about in terms of their journey. One thing that we do know is the importance for those with high needs of public housing and community housing, because that is where so many people with high needs can access. Private rentals are important, but in terms of those with high needs, it's absolutely into public and community housing, and we need more of that. So the report, when you get to it, there's also a couple of bulletins that are shorter, gives you a profile, but it also looks at the stats. Here you can see the number of clients accessing specialist homelessness services trending up over time. Interestingly, a little bit of a dip during the lockdown period in 2020. Why? Because actually, unfortunately, not all services were able to provide support. It wasn't because the need had dropped. It was actually an access problem. So you can see there the trends in that data. And in terms of the End Homelessness agenda, we want this transitions diagram to change. So on the left-hand side, it's all those people who were experiencing homelessness of one form or another. That's the start of their support period. On the right-hand side, where's the end of their support period? What's great is, yes, some of those in rough sleeping do come down into public and community and private housing, but too many end their support period rough sleeping or move into couch surfing or in short-term accommodation. Too many of those in short-term accommodation end up back in short-term accommodation and not enough transition into permanent housing. So we want this diagram to be transformed. This is the look of the world of homelessness support right now. And we need that to change so that we get shifts, flows into public community housing, private housing, permanent housing, rather than back into couch surfing, rather than back into rough sleeping. Now, in terms of our approach to homelessness more generally, we present what we call the Ending Homelessness in Australia model. And essentially it says there are a lot of important structural factors, housing being so important, but poverty is a structural driver of homelessness. Unemployment is, or low wage employment of short hours. Domestic and family and domestic violence is another key cause. We've also got this little section down here, which is what do we need to not only address those structural drivers and the immediate problems around homelessness, but what does the system need? And the system needs resources, it needs good data, it needs good service integration, and it needs that representation of the issue. So we then develop a policy program linked to the data that we've gathered and the evidence from the Advanced to Zero data around what do we need to end homelessness. And here's a common ground in Port Augusta. One of the key factors in terms of supported housing is that common ground model, but there can be scattered site models of support and providing that stability on the ground. But I'll just end here. And this is, if you like, the 5-point plan, if you like, to end homelessness. First of all, we need leadership and proactivity at the Australian government level and a national end homelessness strategy applying right across Australia and across states and territories. We know that a lot of states and territories have actually done good work. Of course, they needed to, they were required to develop their homelessness strategies, but they have actually committed significantly. They need to do more, but what is missing is the Australian government and a national strategy. In that, of course, we need to increase the supply of social and affordable housing. Again, states and territories have gone beyond what their base commitments have been, but we are so far back. We really are so far back that we really need this very big injection beyond what state and territory governments have already done. And in that context of high need, we need to have housing first programs linked to supportive housing for those with those high needs. And those support dollars are just not there at the scale. So we've seen great programs, and we've been involved in terms of the research on great programs and common ground great programs. So brilliant programs have been put in place. It's the scale of the supportive housing is what we're talking about. Then we need to go back to our underlying model of homelessness and say, we need to get in there early. And Lee referred to this as well. You know, we need to prevent right at the beginning, but when someone does experience a spell of homelessness, if it's as an adult, as a teenager, as a child, get in there quickly to address that homelessness before it ends up in years. And then we need those supportive programs, advocacy, commitment, resource flow, effective service integration, culturally safe and appropriate service delivery, including expansion of Aboriginal Torres Strait Islander-led and controlled services. And we've seen, for example, here in WA, a significant expansion just recently, and data quality evaluation and research around Australia. So I'll just end there. I know I've probably gone a little bit above my time, but yeah, thanks for listening in. I'm sure you've got the reports online now. I'd just like to thank all of those who gave of themselves, both in terms of those experiencing homelessness and the services who got all of this data together.
Thank you, Paul. That was a lot of information covered in a short period of time. So luckily we have a wonderful panel that can help us unpack all of that and to start to answer some of those great questions that have been coming through on the chat. So thanks again, Paul. I might just introduce all the different panelists and then we'll start to run through some of the questions that we've got. But Paul's mentioned a few. Obviously, Paul's going to be on the panel. Lee, we're really grateful you can stay with us. Can I introduce Jess, who is one of the panelists as well and was one of the authors on the report. So Jess is the Advanced to Zero data lead. She works as part of the Quality, Innovation and Performance team at MICA Projects. She's the founder and lead analyst of Curious Communities and was last year the South Australian Social Worker of the Year as part of the Agents of Change category. And I can see Jess blushing now already. Shane Jakopek is the regional manager of Neami National, working in New South Wales and who are obviously delivering a range of mental health and homelessness services. Shane's on the board of the End Street Sleeping Collaboration in New South Wales, one of those key organisations that drives this work locally. And Shane's is a widely respected advocate for efforts to end homelessness across Australia. And last but not least is Karen Walsh, who is the chair of the Australian Alliance to End Homelessness and CEO of MICA Projects in Queensland. There's few people in Australia, I think, who know more about ending homelessness than Karen, and even less who are so willing to share that knowledge. So grateful Karen and everyone as part of the panel could be part of this discussion today. So I might we'll stop sharing the names of everyone on the screen now. And I might throw back to you, Lee, if that's all right. There were a couple of questions that people wanted to ask. And one of them said, I hear you talk about the importance of outreach. Do you believe that outreach after usual business hours and on weekends is more vital or as equally important as the current funded outreach during business hours? Did you catch all that, Lee?
Yeah, 100%. Like, you know, you are going to find the most vulnerable at the most vulnerable times. During the day from 9 to 5 on Monday to Friday, generally they'll be out seeking, you know, yes, okay. Basic, simple, 100%. At night, you need the people out there in the locations. It's a dangerous job. It needs to be funded, needs to be monitored, needs to be looked after. The people need to be safe that are performing the work, because there is mental health that can go off at any time. But those hours are when you're going to find the most vulnerable and the most needy. Does that answer that?
Absolutely, and very passionately put. Thank you very much. Paul, I've got a more sort of technical question for you. Tim has asked, do we know how many people under 18 are homeless? Have you looked at that as part of this report? Or is it something that sort of falls outside of the scope of this report? And you're muted.
Sorry, it doesn't fall outside the scope at all. So the report does look at the whole picture of homelessness. When you look at the Advanced to Zero data, though, it is focused on those 18 and over. And it's one of the important things that when you look at services that are working, say, around in the cities and the like, they tend to be working primarily with adults. And if you go out to the suburbs, you're getting more and more children, teenagers and the like. So it really just depends on the group that you're looking at. But no, I mean, under 18s, as we know, very significant. And we focused a lot on youth homelessness. So it's a very, very big issue.
Great, thanks, Paul. Jess, I might throw you on to you on this one. Melissa has asked, is the data available for research collaborations to use? So I guess the sheer fact that this report's being made available kind of answers that question, but I thought you might want to unpack just what's the process involved in researchers accessing the data to help us do this kind of work.
It's probably also a question for Priscilla as well.
Yeah.
So as far as I'm aware, you just need to contact some of the data custodians. There's an online form that you can use. I think we could probably find a link to it to put in this chat and just apply for using the data. Paul, I think you need to nod with me around that. That's right, yeah? Awesome. It's not too hard, but I guess we just need to talk through what to use it for, how to collaborate, all of those sort of things. And it's all de-identified, of course.
Great. Well, there's another question here from Donna in WA. Really keen to see the data and why people were evicted after getting accommodation. What can we do differently? Any reflections on that at all?
Yeah, so it's you can see in the diagrams, the by nameless kind of diagrams, just the extent to which people come back into homelessness, including on the streets after being evicted. So the data itself says, you know, have you returned from housing? And so we examine that. The return from housing into homelessness is a significant issue, and the data is there. So you'll see in some of the diagrams that kind of re-entry. And it's a really big issue. That's one of the reasons why, you know, Karen and others have argued for supportive housing models for a long period of time. And those who have been involved in service delivery know full well that there's been this big push around tenancy support to stop this re-entry. It's a big one. It's a very big one. So the data actually shows it. Yeah, significant number returning to homelessness from housing.
Cool. Thanks, Paul. Danielle has also asked a question, and Karen, I thought you might be able to help with this one. Are you there, Karen? Yeah. Which is, oh, I lost it. Do we obtain data from organisations that are unfunded, i.e. they're not getting funded by the government to support this, doing the sort of data collection work that occurs as part of the Advance to Zero movement?
Hi everyone, I'm coming from Jaguar and Terrible land. I think that's a question that each local community has to answer when they're part of creating a by name list, and who are the voluntary services and how they can contribute is you know, a really important question that has to be asked. So sometimes there are voluntary services that are in a position to assist, and other times it's more about linking in with the services who are more able to undertake the survey with people so that they can connect them to housing and support. I mean, the survey is a screening tool and it's important for services, and it helps services really understand in a structured, quicker way what are the needs, the histories of people's homelessness, and the kind of connections that we need to make in order to provide housing and support. That's why we're collecting the data, is to house and link people and support people much quicker than if we were just, when we were doing outreach before 2010, we were going out, we didn't have structured ways of focusing on an end result of housing, on what services need. Sometimes it would take months to find out what people needed. It was more relationship only based. When you need a relationship, obviously, to work with people, and we don't want to give that up, but a relationship plus maintaining data-led forms of work is really giving us both that insight from our relationship with the person, as well as, well, what are the trends and what's happening? Like, you can look at how many people are returning to homelessness and take a bit of a deep dive into it. How many people were in social housing and now back on the street? How many people have come from prison? We have in Brisbane decided to look at families. So we've got 164 family names on our know by name list for families that includes people leaving domestic violence. So each local community has to really address those questions, because the purpose of all this is to house and support people better. But data really helps us do that, and to understand those trends and to understand what we need to advocate for and what systems need to be involved, like healthcare, domestic violence, children's services, young people services.
Thanks, Karen. Shane, I was wondering if you might be able to this next one. We have a record low unemployment and a lack of available staff for the service industry. Surely we can link these two. Question mark from Tim Cheeseman. I'm wondering if you have any reflections on that statement at all from your perspective.
Look, employment's critical. Lee is a perfect example of stabilise someone and they can get back in the workforce. People want to work, they want meaningful activity in their life, and you know, it really gets down to that, having that stable housing for the person. And you know, we bang on about it over and over again. There just isn't enough stable housing, affordable housing for people to actually start their journey of getting out of homelessness. So really, that's a really pivotal, critical thing. And you know, we at Neami see employment as a really critical aspect of someone's journey, and we've embedded an employment program into the STEP program where Lee's been involved in, and it clearly it's had amazing outcomes. People want to work, they do want to get out there, and they can work in the disability sector, and Lee's a perfect example of that.
Thanks, Shane. And another follow-up for you, if I could, it's just around data collection. So somebody's asked, Danielle's asked, how do you get information on couch surfing and rough sleeping / do you get data on those how do you get data on those who are sleeping in their cars, kind of stuff? Could you take us through some of that if you're comfortable?
Yeah, look, it's couch surfing typically, we don't know where people are couch surfing necessarily, and so that actually comes as a byproduct of the conversations. Where have you been when you're doing that survey? There is a Jewish House have developed an app called the Mend app, where they're trying to engage community so that they can actually input that information themselves or identify that they are couch surfing or know someone that is couch surfing. So that's actually a bit of a work in progress that Rabbi Mendel Castell's been advocating for very strongly. But it's a really good point. It's hard to get that information, and it's usually after the fact when they've come from couch surfing and they're engaged on the street or in a crisis accommodation.
Great, thanks, Shane. So there's a bunch of questions here about, I'm going to pick one out, but let's have a sort of general conversation amongst all the panelists, I guess. But it's the government's heard all this before and they've done nothing. You know, we've heard these kind of reports. We know the costs are going, you know, what do we do to get the government to do more is one kind of summary of a couple of questions we've had come through. And the second bit is, well, what's your view on the next National Housing and Homelessness Agreement and what should be in there and included? So I might run through the different panelists, give us your reflections on that. Lee, can I start with you, if that's all right? What if the government's not listening, what can we do? And what's any reflections on the National Housing and Homelessness Agreement? What needs to be included in there?
Karen, from Micah Projects, I don't know, she said more about the personal relationships with people to end housing is good, but we need data to offer to the government so that they have to listen. The numbers are out, they're out of the roof, through the roof. But that's not a correct even, what do you call it, idea of what's out there. So whatever numbers we have, you could nearly double. So whether to get that, I think I don't know. I'm more hands-on, and I take the personal relationships and I try to fix people individually and try that. But I think we need to, like Aaron said, get some good solid data that shows where the help. Affordable housing is just like, it's a no-brainer. We've got to have it. It just has to, affordable housing has to be focused on. Like, so you go down and you try and you get some temporary housing, you find yourself in homelessness, you get 4 nights accommodation, you've got to come back with a list of applications that you've had, and most of, you know, like a homeless person is unable to go and negotiate a private rental with a private real estate and things like that. Just affordable housing with organisations that run the affordable housing on a much larger scale, where the people can come in and have an understanding of the real estate agent isn't a real estate agent, it's a social worker that understands homelessness and that is willing to work with that person and knows that person, not just a real estate that's trying to release a property and so affordable housing. Just get the money into it.
Thanks, Lee. Karen, I might throw to you next if you got some reflections on those two questions, the sort of what do we do about the government and the federal government not listening, and what should be in the next National Housing and Homelessness Agreement?
I don't know what we do about governments, but I do know that we do have a lot of data. And when you look at the AAHW data, you look at the sort of data we're talking about today, you look at the experience of organisations, and we need to value that a whole lot more. You know, we listen to people with lived experience who over and over have told us they need outreach services both when they're homeless and when they're housed. But we absolutely need to build and really plan a supportive housing system, not just supportive housing projects, that if we can house the most vulnerable and people with the highest needs, it'll be easier to house other people as well. But we know that just matching them with an available social housing unit anywhere and trying to match support together, only, you know, it works for some people, but there's still a significant population that even with outreach support, it is very difficult. So I think we do need to consider models like the common ground models, but that's not the only configuration. But there are many supportive housing configurations for different population groups that we could look in. But we've got to go to scale. Like we need a system that will match the investment for services, the subsidy for housing providers, and the people who need the services the most. We also need to make sure that we take clinical services to people on the streets, but not in isolated. We don't want to replicate the silos that our health system have. We need to make sure that we're really integrating healthcare, clinical care across mental health, drug and alcohol, primary health care, supporting women with escaping domestic violence. Like, these things can be done in a much more integrated and comprehensive way than just silo responses that aren't connected. And the homeless population, more than probably any other population, benefits from that connection, from being homeless to being housed and then supported when they're housed. And of course, prevention. You know, we also know from the data where we need to put the emphasis on prevention, and we need to be able to do that. I think really the white paper and the strategy that the Rudd government had is an excellent place to start. Look at progress. How do we make sure that we call for investments in those areas of prevention, breaking the cycle, realigning service systems and supportive housing more fully and across all population groups? Like, there should be no one homeless, doesn't matter whether they're what age, what characteristics, that we need a population-based response, not just siloed subpopulation groups. So all I can say is we need to have a government that cares, a government that doesn't fob it off. The state and Commonwealth agreements, whether it's housing, education, homelessness, domestic violence, they need to work properly, not in the way that they've been working, which is one party blaming the other. And local governments need to be much more actively involved, because it's the local community that is impacted on by homelessness. You know, they have land, they have infrastructure money, they have the ability to contribute to these solutions. So I think we've just got to keep at it and keep asking and telling people it's their job.
Thanks, Karen.
Can I add
Shane?
to that one?
Lee.
Thing to all this, if we're talking about that, an outreach service, a GP outreach service, and specialist services that can attend people's homes in that or like albeit the great result that they can meet a person in a park and consult with them there. But an outreach service from hospital or where it is, just a big body of doctors that can go out to the communities and see people at home, because that people are sick at home and dying at home because they can't get to the doctor. And that's another big one. Anyway, I'll mute myself now.
Thanks, Lee. Shane, did you want to jump in on this question we're talking about?
Yeah, absolutely. Look, Karen's listed a lot of the key areas there. I think one I just wanted to sort of highlight is, you know, it's great that we're seeing the length of time people are sleeping rough reducing over time. I know when I started working in this space, you know, it was a lot larger, as you mentioned today. So that's one positive thing, that we are getting to people sooner. It's disheartening that we keep seeing people come to the street. And so I know in New South Wales, we're starting to see a bit more investment into the early intervention programs. I know there was, Paul, you mentioned a little bit earlier around what are the factors that are people that are already tenanted, what are leading them to the street. One program called Sustaining Tenancies has been working quite well. We run a number of them around the state, and one of the key things around that is people are losing their tenancies through in public housing through rent arrears, nuisance and annoyance, or damaged property. They're the big drivers, and this program's taken a bit of a different approach, and it's targeted those key aspects where someone can get referred to the agency and they work with them for 12 months before they've lost their tenancy. They work with them with the tribunal to make sure that they can work on any of the life factors that are influencing those things. A lot of the time it might be someone else coming and living with them that is causing the problem. It's not actually the tenant themselves. So we're seeing great outcomes for that early intervention prevention, and heaps more funding needs to go into that space. So I'd love to see that working in addition to the work on the street to get people off the street and the housing issues. Read the national plan. You know, this is really great that we've got this report now that Paul and his team have put out there. We do have these national movements collecting this information. It is a pretty big national picture now that we have, and collaborations are continuing to do that work and collect that information. I think for the national plan, it would be great to have an actual funded approach to how we continue that data collection, because we can really start to see those inflows and outflows happening at a national scale now, and seeing where those key drivers are that are leading people onto the streets. So it would be great if that was funded as a national coordinated approach.
Thanks, Shane. Music to my ears. Jess or Paul, did you want to add any more to that other than what you've outlined in the report, but on those two kind of questions? Jess first, maybe.
It's hard to really add to anything else to note to what the other folks have said, except that I do think we have a responsibility to use what people are telling us through the data for advocacy. You know, if there are vulnerable people who are telling us what they need, we have it there. We should be using it, and people should be listening to it. It's coming straight from the horse's mouth.
Paul, thank you, Jess. Absolutely agree. Paul.
Yeah, so obviously the report does go into a lot of detail about what we need to do, but I would just say that the points that Lee and Shane and Karen and Jess have made have been absolutely spot on. And we come back to the fact that there is a missing piece in the puzzle, and that is a national homelessness strategy with increased support from the federal government, who we must say do some good things. You know, anyone who's done a Reconnect program knows wonderful. It's a great program for kids, as well, adolescents primarily. Great program, and they've done it for years. So we just need the federal government and a national strategy there in place, and I think that's one of the key points that we'd be making.
Thanks, Paul. And I guess I'd sort of, editorialize myself from the chairs. I think we're all very familiar with the concept of strength-based approaches that we do when we engage with people. And actually, we generally engage in advocacy that is a deficit-based model. And it's basically saying, why doesn't government care? And beating up on government more, whatever persuasion, whichever level of government. And I think that one of the wonderful things that I've observed about the Advance to Zero movement is it's kind of the community sets the table and invites government to be part of it and make it a positive thing and say, hey, we've got the data, we've collected the stories. How are you going to put your shoulder to the wheel to help us with this? I think it's a very different advocacy ask to the one that's been tried again and again with often little result. So Anyway, but I do think I agree also with what Tim Cheeseman said in the chat, that governments care if people care, and we've got to do a better job of bringing the community with us as well. So can I pivot to family homelessness? There's a couple of questions about that in there. Quick one for you, Jess. Did we use the family VI split out through the data collection in this report? Was asked by Linda.
Yes, where communities actually implemented the family VI split out. So not across all communities, but the communities that did use it.
Yeah, thanks, Jess. And then the follow-on question for you, Paul, was what did the report tell us about families experiencing homelessness, and what can we learn from that?
Well, I think the main thing is that families want to have that stable housing position. So there's no question that when we're talking about family homelessness, we're often talking about a situation where families are not always actually connected together. And one of the things that really comes out when you work with family homelessness services is that the home, getting into permanent housing with support, is the point at which that family can really get connected to each other. That's one of the big stories about family homelessness services. And you get it all the way through those comments that we showed in terms of what you need to be safe and well. Constantly we're seeing the comment, this means that I can reconnect with my kids, or our family is now safe. I think that's probably one of the biggest issues that comes out of the family side of this. It's really connecting with each other, making sure kids are safe, making sure that kids are reconnected in a safe environment. That's the key around that family homelessness area.
Thanks, Paul. Monica's asked, I'm not sure who wants to grab this one, but is there ever been a trial of like a buddy system where someone like Lee can be paid to help someone find and adapt their housing and employment situations to be part of an ongoing support? I don't know, Priscilla, you wanted, or Shane, you wanted to jump in on that in terms of...
Look, I'll let you go off in a sec, Priscilla. I know Neami employs peer support workers that have lived experience of homelessness. So that's actually an area that in the mental health space has been around for quite a while. It's quite recognised, but it's still an emerging space in the homelessness area. And so the requirement for contracts to employ people with lived experience is a really important start moving forward. So that's one thing. A buddy system for volunteers. I know Vinnie's did it in the mental health space. They had a program called Compere where they had people trained up as volunteers to buddy up with people with mental health issues. So I know it's been done in that space again. I haven't heard of anything in the homelessness space. I'm not sure if you have, Priscilla.
I mean, I'll just add to the some of the work we've done with the peer workforce at Neami is that people who have experienced homelessness really relate to people who've been there too. They tell us that they really love connecting with someone who knows what it's like to be on the street, and they love getting support post-housing from someone who's also made that transition because the person gets it. So I think it's a really valuable support, and probably one we could invest more in.
Thanks both. Paul, can I just ask you a couple of just questions around the scope of the report that people have raised? So is the report presented reflective only of data collected by agencies that use the VI split out? Is the first one. Second one is there's high levels of homelessness in the Northern Territory, but there doesn't seem to be much data collected here from the NT. Is that skewing the data? And yeah, another follow-on question similar to that around the Northern Territory. I thought you might want to answer both questions at the same time.
Yeah, so in terms of the data, the report actually does those three things. So it does actually look at the census data, it looks at the SHS data, Specialist Homelessness Services data, and does cover the whole of Australia in terms of those data collections. So you will, and also looks at all the drivers. So there's 4 or 5 chapters looking at that total picture. When it comes to the Northern Territory, you're right, it is missing in terms of the advanced zero data, not in terms of the other data. So that's a gap that needs to be filled. There's no question that the Northern Territory is a gap in the data collection. You got to remember the origins of this data collection were very much services that were working in inner cities. And we actually called, when we looked at some data a few years ago, we called it homelessness in Australian cities because it was Australian cities. Now, it turns out that we've really seen an expansion of the zero projects and the by name list and data collection outside those kind of, say, inner city precincts. And right across Australia, you'll now see zero projects and data collection in all sorts of places. You know, and if I take Western Australia, it's in Rockingham, Mandurah, etc. It's not, or Geraldton, it's not just in the inner city of Perth or in the inner city of Fremantle. It is expanding out. So as we proceed with this work, we will see more and more it expanding out to regional towns. And at present, there are gaps in terms of remote and outer remote homelessness, and there's a gap in terms of Northern Territory, no question about it, in terms of advanced to zero.
Thanks, Paul. Yeah, and it's worth adding from me. I just think that the data is collected from those who are willing to go out and do it across the country. And yeah, we do have some gaps, and that's not a criticism of the Northern Territory. I think we all know they face some pretty unique and challenging circumstances, but it's also Tasmania and the ACT that we don't do a lot of collection on at the moment. It's just the nature of this national movement that's evolved and been led by key leaders like Karen and others that have encouraged other communities to take up the mantle of seeking to end homelessness using this data-driven approach. So I was going to save it to the end, but you know, anyone listening, if your community is not part of this, you should seek to make it happen. Have the collaboration and the conversation amongst all the community organisations in your area, and say, what is it that we can do to start using a common data tool like the VI-SPRAT and build a by name list and use that to inform our advocacy, to inform our service coordination, to inform our efforts to improve the lives of people on the street in the community we're in. So there's plenty of information about that, but I will stop editorializing and get back to questions. So Karen, there's one here for you, which I know is an issue close to your heart, which is what specifically can be done to improve the linkages between homelessness organisations and health services and others like Centrelink and housing, etc.
Well, I think the way we all work, we can improve the way we streamline our systems with hospitals, Centrelink, domestic and family violence, you know, cultural groups, Aboriginal and Torres Strait Islander managed services, culturally specific services. And we can do that in our one-to-one work. I think systemically, though, governments who tell us to collaborate more and be more integrated, you actually need to provide some funding that is there to support that integration, that it isn't, we're never going to solve homelessness just one by one individual or one by one family, even though that's what we're committed to doing in our services every day, that we're taking all our effort and wanting to end homelessness for this person and this family. But we're never going to end homelessness without looking at these systemic issues and how we can streamline these relationships more. And I mean, some governments have made a priority to look at how they can address no exits into homelessness from child protection, hospitals and corrections, but it isn't very advanced. And for us, I know as a service, it takes resources to integrate, and often those resources are on top of the case management that people are doing. It's like being able to employ peer workers. We'd love to have a peer worker workforce, but you have to have a case management and a peer worker workforce working together. And often there's just not, the funding pool isn't big enough to really look at all these elements. But I think that flexible funding that isn't prescribed about, you know, from the top, and organisations really put their innovation hats on and look at how can we actually get more streamlined communication, referral pathways, how can we share, how can we have what's the data we keep about integration? It's pretty hard keeping data about it. And I think that's what we've learned doing and learning from community solutions at a local level, the by name lists. It does really help us look at how do we improve these things. even organisationally, where you have different teams working with different population groups, how do you actually make sure you're not letting people fall through the cracks or just creating, you know, more silos? It's sort of a practice issue, but it's also something that needs good leadership, and you have to work with government and non-government services across the sector. But it's really hard to have the time, the effort and the frameworks to do that. But I think they are evolving, and different local communities, they won't be the same everywhere.
Thanks, Karen. That leads on to another question that I just kind of had, which Shane, you might be useful to answer, is like, what's the role of local government here? Perhaps they could be more formally integrated into the development and implementation of the national agreement, suggests Claire, and also says that there seems to be little consistency between the states when it comes to the involvement of local governments. Do you have some reflections on that at all, Shane? And I might ask the other panelists that sort of same question.
Yeah, David, plenty of reflections on that one. We've found local government are critical partners in solving homelessness. If you think about it, the local government is the one who decides the policies around the street benches and whether they have a, you know, divider in the middle to stop people sleeping on them. That's the level of detail that local government has control over, and they can be a great ally when they're on board. A lot of the time, they can be the first ones identifying where the broader homeless people are sleeping if it's not very evident, because if you think about across Sydney, which is my patch, you know, inner city is very different to, say, Parramatta versus out to Penrith. We get a lot of people sleeping out on the river out in Penrith, which is very, very different to the parks in the city. So needing to have that local intel from the local government is really critical. And we've found when they do come on board, they can be an amazing asset to help solve the issue or work towards solving the issue.
Yeah, great. Thanks, Shane. Thanks, Shane. Paul, did you want to anything add on that local government question? I know you have to run away, so as a sort of last comment from you as well, just on local government.
Local government has dramatically improved in terms of its focus on homelessness. So we used to have certain, councils such as the Sydney City Council that used to do a lot of work. And few councils around Australia that did significant work, but now we're seeing it spread out, and local government has really, across the board, improved in terms of its focus on homelessness. So it's a really big area. They are very important because they're down on the ground, and I think one of the areas where local government really can do an important job is that almost like that outreach kind of area for those who are in cars and sleeping rough in sort of somewhat hidden places, if you like. The local councils, by adopting a positive attitude and a really strong rights-based attitude, can really do significant work in supporting people who want to actually be a little more hidden and also want to be safe. Like, there's nothing worse than being in your car and someone hoons around you and lights on you. It's a horrible feeling. So we need to make sure that we connect very strongly with local government, because they are out there. They can see the car parks. They can be seeing those people who are somewhat more invisible in terms of homelessness, and it's a very, very important area.
Thanks, Paul. And I think the thing that Karen was talking about before, that if you want to have service integration and coordination and lived experience voices and all of these things, it takes resources, and sometimes direct service delivery isn't something local government's willing or able to fund. But they do have a role in supporting those things that help with the coordination and help with the transparency of what's going on in the system. And there's been some real outliers or some real leaders in some areas of local government across the country, but it's very sporadic, as one of the commenters mentioned. I got the next question here is from Brew, asking, does the panel have a reflection on whether there's a difference between the National Housing and Homelessness Agreement that we have and a federal government strategy? What's the difference, he asks. Does anyone want to take that one?
I think I'll have a go.
Thanks, Thanks, Karen.
I think if it's a national agreement, it involves really working closely with local and state governments. And a federal agreement should really look at where the federal government's key service delivery and investment areas are, like health, and they have to put into capital funding for housing. I mean, it's just an opinion of this government that it's not their responsibility. It's been the responsibility of federal governments for years to share that with the states. So, you know, what's people's opinions and what's their strategy are completely different. But I think that a federal government, there's a lot to look at in terms of the connecting up and how the safety net in Australia is really declining. Like, you know, they could look at income support and increase New Start, and look at the ripple effect that would have in assisting people pay rent. They could be doing studies that would demonstrate this. They've probably got the data, but there has to be a commitment that even within its own jurisdictions and the silos of funding that they provide to citizens, that they would also look at how can they realign what they do to meet the needs of the most vulnerable citizens, rather than just leave them in very siloed and stressful situations.
Thanks, Karen. Anyone else got a reflection on that one? Not seeing any nods heading. So I've got a question from Darren here that I thought, Lee, you might be able to help us with. The report mentions that many people who are experiencing homelessness have experienced discrimination when seeking services. And do you have any reflections on that? Any thoughts on how that might have occurred or what to do about it?
Wow. So we work with a lot. I work with a lot of Indigenous people. The discrimination there is pretty rough. Like your Aboriginal legal services, your Aboriginal medical services, they are at the point that they cannot take on any more clients or participants. Like in Redfern, they're chock-a-block. They're at the thing. GPs, discrimination is by not being let into a venue to purchase food, being asked to leave because you're not in proper attire. Think that sort of discrimination. Yeah, I think the world is getting a little bit better. I know in the city it's a lot better than the outer suburbs and that sort of thing. But
no, that's really good points, Lee. Thank you. Anyone else from the panel want to jump in on that discrimination issue? Shane?
Yeah, I just reiterate what Lee said. You know, we know 20-25% of people, First Nations people, are homeless on the street, and yet there is not a representation of First Nations agencies to support them directly. So it's white agencies trying to support First Nations people, which isn't the best approach to start with. I'm not saying white agencies can't do great work in that space, but there needs to be more work around building capacity of First Nations agencies to work with their own people on solutions, and so that's really, really critical. But yeah, unfortunately, discrimination, particularly with people sleeping on the street, we still see a lot of people being shunned. We talk about fear. That's a massive issue for people, for their own safety. So that's a really key thing that we need to sort of be aware of as well.
I also think people with histories of criminal prison, they're discriminated in terms of their ability to get work. People with drug and alcohol use are also discriminated and excluded from services without really understanding what is behind that. It's treated much more as a law and order issue than a health issue. I think many people get judged as being on substances when in fact they're just very unwell. But even if people do have addictions, they should be able to access the services they need. And I think they face a lot of discrimination.
I'll just touch on that one is exiting prisons. post incarceration. That it actually astounds me. I do some work with organisations that post release. The number of beds I think that are available in New South Wales is 48, and there's over 19,000 people being released from prisons into homelessness each year. So 19,000. Oh no, that's the total release of prisoners, but 48 beds in New South Wales are assigned to post-release prisoners. There's no housing other than linked to home. That's all that the prisoner has to leave home. From there is where the cycle just does its whole. It just they've got a minimum. I say within 2 weeks, I'd say they would reoffend if they're just sent out into transitional housing. They can't manage to follow the rules of the transitional accommodation booklets and things. Boom, they're homeless again within 2 weeks of leaving prison. There's 48 beds to keep people that are dedicated to people leaving prison through organisations. That's a major place to look at as well, is supporting people as they're coming out of prison and addressing recidivism before, and housing's a major part of that. Is that all right? I'll mute myself.
Yeah, thanks, Lee. I mean, Lucy just said in the chat that system abuse is what we're talking about here. I think that's a very interesting way to frame that. I think that's quite some powerful language. Well, I'm sorry I have to cut off the questions, but we've run out of time. I might just run for one last question to each of the panelists if we can. And that is something that somebody asked us before, which is, what's the one thing that we can do as individuals to help end homelessness? And if I might add to that, what's the one thing that you think government should do that we haven't covered? So I might start with you, Shane, if that's all right. What's the one thing individuals should do, and what's the one thing government should do?
As an individual, vote for the party that's got the best housing policy. That's what I'd say. That's coming up pretty soon. And what was the second part? As what government should do? Well, Paul touched on the national strategy, really critical, but keep funding. We know there's lots of programs out there that already work. We need to make sure that they're funded appropriately and that housing is affordable. So a few issues there.
Thanks, Shane. Karen? Karen, you're muted, but you have an answer. Yep.
Sorry. Lee, I agree. We should vote. Considering the impact of policies on housing and homelessness, we should educate people about housing and homelessness as well. And individually, I think we just have to keep being committed to working with people to find the solutions and, give voice to their experience.
Lee, anything you wanted to add on those questions?
Personally, what we can do is honestly show the love, donate to the organisations that you've researched and you can see are making an impact in this space and that need the funding and support from the community. And exactly what Shane said, pick the right party to vote for in this next elections. And when the elections come up, the people that are interested in this situation, vote for them.
Thank you, Lee. And Jess, anything from you on those two?
I think the biggest thing that I would say is something the government could do would be to listen and embed their knowledge that they are hearing from organisations and individuals into policy and service design. Yeah, it seems quite simple in my head, but
yeah. It does seem simple, doesn't it? And in some ways it is. The vote for the parties and the organisations, the people, candidates that are going to advocate for these things. And I think if there's one thing that I'd add to that conversation is let's put the pressure on them now. So there is the Everyone's Home campaign. Somebody asked, is there a campaign on this? Yeah, Everyone's Home is campaigning for more housing in Australia, social housing in Australia. Support that. The Raise the Rate campaign for good is supporting a raise of the income support level. Support that. The Advance to Zero campaign is supporting the local collaborative efforts to raise the awareness about how much homelessness actually exists in individual communities. So let's support that too. And let's just write to politicians. We all just spent an hour and a half listening about this problem. If everyone could do one thing and send an email off to your local politician, not a standard email, not a block letter, and ask them, what are they doing? send them a copy of this report and say, what are you doing to learn from this? That would be one way in which we could show a little bit more conversation about ending homelessness in this campaign. But that is enough. That's the wrap. So thank you everyone for being part of this conversation. The slides will be shared in a post-event email. We'll have a survey to learn about how we can do these things better as well. So I encourage you to fill that out. We'll have a copy of the report in the email as well. So please share it far and wide, and let's get the message out there that ending homelessness is possible. Thank you to everyone who was involved in making this report happen, Centre for Social Impact, Neami, all the authors. Thank you to everyone who was involved in organising this event today. So particularly thanks to the MICA team and 50 Acres team and everyone at CSI. And thanks to all the panellists, and a special thank you, Lee, for sharing your stories. Really appreciate you all being here, and we'll see you at the next thing, and go spread the word. Thanks, everyone.
Awesome.